Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent. Last week, federal lawmakers introduced a bill to reverse Medicaid and ACA cuts and expand Medicare to provide dental, vision, and hearing coverage for seniors. Senator Bernie Sanders and Representative Ro Khanna have been on the front lines of this legislation, and they're calling it the Make Billionaires Pay Their Fair Share Act. It's an attempt to repeal some of the deepest Medicaid cuts enforced under the One Big Beautiful Bill Act. The legislation would also restore the expired ACA subsidies by removing the 400% federal poverty level income gap. This would be all funded by a 5% annual wealth tax on those with a net worth over $1 billion. Whether or not this funding method would be sustainable or even considered by Congress, this bill is an important move in the direction of refunding Medicaid to our most vulnerable patients and hospitals across this country. On to the damage report. We've reported on this podcast before that Michigan's proposal for spending Rural Health Transformation Program funding was disappointing and did not adequately represent our state's rural healthcare needs. Now, many more states are saying the exact same thing. As CMS announced approval for funding applications from State Department of Health and Human Services, healthcare leaders are voicing their growing concern over the results. Many expressed frustration over the quick turnaround time states had to submit applications, and others cite the structure of the program itself for the inadequacy of the funding allocation. We encourage rural hospitals to continue interacting with their lawmakers and state health departments to push back on insufficient funding and poorly allocated resources so we can truly make rural health sustainable again. In other news, hospital and health systems have been taking a hard look at the financial impact of the Affordable Care Act coverage losses. As patients continue to drop their insurance plans due to expired enhanced premium tax credits, a real picture of financial loss is now forming. Large for-profit health systems expect to see 15 to 30% fewer patients who were previously covered by an ACA plan. One health system, Tenet Healthcare, fears for its facilities in states like Arizona, California, and Michigan the most, anticipating a 20% drop in the exchange enrollment. Nonprofit hospitals have been hesitant to project exact financials, but also expect a sharp decrease in patient volumes, resulting in meaningful losses to their bottom line. And now for the success story. Juniata College is forming a rural health collaborative with other local organizations to contend with declining healthcare access in their rural county. The purpose of rural health collaboratives is to maintain rural healthcare access by consolidating resources, reducing cost, and standardizing practices for local hospitals and clinics. By forming a collaborative, Juniata College aims to address the healthcare workforce shortage in their county by bringing in more training opportunities for students and community members. We can keep healthcare access local when, and only when, we strengthen the organizational partnerships with our rural communities. Thank you to our sources for this episode: Becker's Hospital Review, CBS News, Modern Healthcare, and WPSU.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.